Yo, I think say consider be a draw and say about 10 o'clock ako radio ye bamo so ye the apomodin ehun nkomo ebremo and then anopay and say with the same news na de bremo um yenya Dr. Atu Hanom na se never start to cry de asida bema otweriampon kwami say wahwe so na boni bia nkan wiki mu na yasan be hie mu bi na kwamna so ba the intimity in so want me amake nsa wo ha metina akonye mu ama no na me ne Dr. Atu atwetwe komo afa prostate cancer ho we topic bi ansi aka ho asem emredi etwam na ne be sent mu bi na wo mu a omo nya kwan enti ne last time no mo so be den nya kwan akonya na omo tie bi na ma share enti ni sere wa se wa join feed sisi a koso na share feed no ma na na ye be kan se be ebe benefit na se be boy kwan be so enti ye nche ho kra no mekọ ahụji mu me ba na ebe komo no asese so for continue sere wa share na make sure so be and
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
yo yedamasi se mugusuna mutin yasan aba back commercial break in your ni aba back na yeden komo ba hihye so ano no nse na ye kan se be prostate cancer ho asem na nya Dr.Baidoo hanuma nse onye obi oyo hoko okan akọ abusu so one of our big leaders enti ene no obecheche enema bebre afa prostate cancer ho yare bi atense di nyapa especially yenma ye free abibire mu ayo tuntumfo na it's a high impact yare bi a message say obi ohwe bia no be make sure say obetwa benefit bi na wama onua so riding atibi na yede nkomo na hyehyɛ so ntimi nkyɛ ho kra me de Dr. Atu beba afidie ni so Dr. Atu na ete saying yo pajote menka
Oh, sorry, Simon mute me. Yeah, Dr.Fori na mi chia oni tiefo nyina ne omo mo hwe nyina so. Nyame adom ye ho ye na I hope so be aso ho ye.
but obi ahụ ye da so be say you twins afro na one people to know abeka ho ha and then say kase beka ho asem ne ye prostate cancer I think say ye di sam komo we pen na ehun hia pa anti na sa atwa ben ha say obalo boy na ye senti mu bi because ehun hia pa na ehun omutie kane first time omutie ni pesi ehun say hwan kwa ne Dr.Baidoo na my introduction kakra na ye komo no asese
Yo atro obviously Ghana ni a obetina kum hanu mo a check akra said me school me is those days me is form Ghana yeah national service no we is form yeah national service and sana wako university but we national service na me ba hanu betwa addition so timili ne mu ana nyame adom between call medicine specialize in anatomic pathology surgical pathologist and cytopathologists me ejuma wo Pennsylvania one of the largest health systems in Pennsylvania. And now in a nutshell, I don't know, and that's what I can say about myself.
You better say one my introduction, say what's in can.
A part of it on Kappa.
Okay, good.
I say a feedback, a video speak. A restoration. So what Kasa neighbor?
Okay.
Me on Kappa. Na yeah.
Hello.
Feedback. Sound. So Kasa.
Echo speed one.
Meaning events the word for it, but they bit my yeah.
Okay. All right. Yo, I think say you better try me for commercial break. You fix this problem into your bar.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS, IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Say your sign up a view and say your sound you check your cases. You're not talking about what you can.
But you on Kappa. Yeah, I think it's a bit Marco. So any major sound issue. Yeah.
If you test to see.
No, kasani them na say kasana like speaker no sound be the tree.
Okay.
Yeah, I think it's be a tree no technical team for me to match.
Yo. All right.
But kasa yeti the okan.
Na after
Dr.Baidoo.
Metonka.
Yeah, I think it's Marco. So yeah, kasa yeti.
Yo. All right, and then I mean, I do a slide and then I start the conversation. Now, prostate cancer, if I can say, yeah.
Yo, Dr.Baidoo, me that's a AD kind answer the baby said, DNA prostate cancer, no, DNA chronic cancer. But the pictures me be na I share with Hanum. Now, the form DNA no, I breaks. I share edit to war. Now, Oduman come and can't say or ye obi orderly. Now, they be all ye pian and was a send pepe. Intino no, me the lower picture ya share a brick wall and send ye see I say a meticulously planned ubina I said that to a layers be a level for fair. Sana nipeduan yakopon born any nipeduan kwana de bonina share there's an order be a tree. Na say disorder ebemwa na say picture here wasuri and no sure there's no plan breaks need be called diagonal be a horizontal be one more like be a kokra na the shape it would mean say a stroke picture near disorderly. It is a cancer and I'm tired this infonin a dear example say now who she share na dear perfect it's a lower picture no and na ya dear I find kokram between a kind of kokram eba nipeduan eba nipeduan mana idea orderly na be changing at the disorder abem intino Yeah, cause a cancer, picture we used to know, it show another way to be explaining cancer. No, where a infonia will be a draw about saying any your skin and I say the tissues na I say. What's your picture now? What's on the left side now? Won't say cells, any box. I can say rectangular shape. Arrow ni point, but you say me arrow no.
Yeah.
Yeah, a point in the out we say order womb. Signing or body and a ball yen or ye. Now cells on a certain foundation. Foundation you can say basal cells. And cancer kokram ebemu yade ebemu ti yade we e na blue no sha there's no order bia and she share fair to say the other sides no na we no na cells so hwe na kese so seeing the normal cells no again another thing I will notice in here say still an basement basal cells no it's in place. Oh, it is a yes say na say you say kokram I cells but still and foundation is in place. I say what nya inside to carcinoma. I just say ujana or best spread it. So cancer all right. And I say a pre-malignant all right. But onyan spread it ujana or best spread one young be or best spread it. Now, into the cancer cells and best spread it. This a breaky foundation. Most of them, most of them, this is a breaky foundation, and sana I spread it. Now, we show the lower picture here, where cancer cells are on we breaking the foundation. How we spread it. It is normally in say cancer, and I could be more and in you at the time when you breaky foundation now, I inside to now, and only a very good for the patient, a fun prognosis. Yeah, I'm saying my slide need free, so yeah. Okay. You can't social America Hanumwa. You come Ghana, the open statistics are over break, and this will be our call a Jubilee House on. But normal open statistics of any ed in Tinia, tidy America DNA issue. US statistics are every year, and I say in the year 2000, now you predict say 2020, you predict say about 1.8 million new cancer cases in your diagnosis. America, a population of just over 300 million, now you move 1.8 million, benya cancer, almost a phobia, very serious, idea, and a can say. Now, some 1.8 million new cancer cases, a move over 600,000 in a bewu. It is each day with cancer is about 1,660. Now, I say a cancer kokram the second most leading cause of death in America hanmo. The kokram any akumayade heart disease. Nti we no sa picture we no chiro kokrama what nipadua no wa America no statistics American statistics what they compare other the different types of cancers and compare nti no so here I say leading sites of new cancer cases and deaths and ya chemu emma ne mema and a mema ne ma in America, new cancer cases, number one, prostate, about 21%. Any prostate, into prostate cancer, they can, and then and fire who can see apart from say, be a mobile, but a man can read any money there. Your prostate cancer. And we prostate cancer now, lung cancer, and then number two. We lung cancer no about nipa colon and rectum number three. Nti ne saa na ɛkɔ na ɛna deɛ yɛka no ɛyɛ for fɛnsɛ mmarima na wohwɛ cancer ekum nipa no so deɛ ɛwɔm sɛ prostate na ɛyɛ number 1 in terms of new cancer deɛ but ɛba deɛ ekum nipa no deɛ a ɛne lung ebitwa no but ekyire no ne bi yɛbɛka lung ho asɛm ɛna ne yɛ prostate nti prostate cancer no in 2020, the year 2020, you know, he estimated about 191,000 cases of prostate cancer in the Bay.
Okay.
And 33,000, over 33,000, and I say the woo year. Say 2020, I found. I can say the woo year. And prostate cancer, and say DrEOfori, or your introduction of kind, no, yen before no. A higher year compared to abroad. I say 60%, incidence is 60% higher in blacks than whites. The reasons and 100% certain. A bit more approximately different reasons. Back on say to for your high testosterone levels and abroad. And one postulate. The other postulate is say young casa to for no. You should pay your attention to your health. Until you man a fencing like you did more exercise, those things, you should pay attention. In your signs and symptoms, you crumple down in time fan call or checking in temp. Every possible, but the exact reason there, and you're very clear, sir. And now rates of prostate cancer spiked dramatically in the 1980s and early 90s, largely due to a surge in screening with PSA blood tests. Around that time, I saw a prostate-specific antigen test. I did screening for prostate cancer, and you develop here. In the 80s and 90s, you say, "What? Who acquire first so edited BB?" I say, "One, I edited more because I can now." None a month on and I'm a movie, but you didn't have it. Yes, I too into who said after the near diagnosis more. Since around 2000, the rates have declined, and this is largely due to reduced PSA screening due to changes in the guidelines. As the chain said, Yenya sa PSA 2 no first na ye screening obi na ye diagnose but see na ya tamper down on PSA 2 because you say PSA no a good tool to have there but enye 100% I can say specific. A very sensitive but enye a specific say and never be to me my PSA no should to echo high. To say if I say prostatitis, inflammation of the prostate, the PSA stroke. Even Quran so we call exams, doctor and I said doctor and examine the prostate. A chain is examine prostate, that process in Quran it may elevate PSA levels.
Okay.
And some other factors. See rates decreased by 3.8 per year on average between 2007 and 2016. Another reason, so you say prostate cancer, a very like weird type of cancer in the sense, it's very hard to predict a nisubai. Obi one more between your prostate cancer, but the best one no phone say enkuno. Obi only 20 cancer no, but enkuno. Into I said the outcome is very hard to predict. Into first, treatment is very aggressive, but see, I back it off kakra because treatment is a side effects. DrEOfori, so we can interrupt anytime.
I think say one question I'm a person in Pisani PSA no one sem. And normally no call routine checkup. Yeah, not doctor for check we more and I say just we'll do some level be an problem then I'm check. I was thinking say checking blood pressure near the I know saying a sensitive there and yes specific there. Yeah. Is there a way say routine and check it?
I'm saying Rebecca who asked them very, very shortly. A very good question will be sir, but answer no me postpone and I'm postpone just like slightly because Rebecca is here.
Okay.
Now yeah. But internet for being fan to dream say process cancer no question is say the screening in PSA no I was saying routinely you could doctor be an ya check here and answer again. Because you be answers a question very shortly.
Okay.
Yeah. Now maybe with statistics, say mortality trends, death rate has decreased by 52% from 1993 to 2017 testing and advanced treatment. Into treatment is good. And I start PSA testing. Now we credit say that if you want man say I can't want same.
Right.
Escape. Yeah. Any kind of you cast a prostate crana anything nipa duano no a hen a wo. Edi can say a ma any prostate.
Yeah.
A ma any wo prostate. Nti mema no your body no hefa na prostate ni crana na ehye. Prostate ni ewo baby o bladder no baby adwonso kidney no eso ni moja nso na meki Johnson enye se Johnson no buy no na like enye se kidney meki Johnson na wo Johnson out yakopon pouch ana bottle bi ewo yimu efe bladder hona Johnson ko tie ne de man mema nyina wo bi na emema de no ufa bladder na fence ne droben na afie Johnson be free my pie ababonten no that droben no be first at the junction between the bladder and the droben and the tube no tissue be surrounded that tube no a friend prostate and the only prostate am the bentoa in a example say bent one bulb part be a squeeze a draw ni gu and nsuo gu no bladder na and this part in a fence tube na so bent one so nka prostate ni this side nka prostate ni surround the tube no it is na picture we so insert a picture so na bladder ni and I say it's a bent one a bulb ni droben tube ni and a prostate in surround okay. The interesting thing about prostate cancer and say and now say surround droben into fence say cancer ebe man say prostate near kesia inya effect senya bema osi jonso because it does make me tube na tum and also say a bit me aye crew tube ni lining no a bit it into the tube line and they say bema no jonso na moja ewo and I say ojonso na ye ne ya you can find the sentence na prostate in the kesie no so offer tennis ball we a tennis ball long tennis ball we a table tennis ball we a prostate into the case it is a CBF and almond almond they send a shell no
okay
prostate in an ACTA
okay
and you know a picture we show like almond normal almond I can see say prostate I can see and I BBC you know, again, a member kwan and prostate cancer because a member kwan or prostate cancer. I will prostate.
Function here then. Sorry, Mintuano.
Oh, okay. Very good question. Prostate nankasa no. Maybe. Prostate nankasa function and say 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 a surround a droben agent of feminine, but it's all just a picture where say droben. There's another branch you are. In a branch we say okay connected to BBFN seminal vesicle. Now say be man or ba shia na say won nemu na be man no hu nsuo no e fa be fa fencing this tube we droben this part of the droben no they do handman na prostate in a releases some chemicals ni enuani duro be a mass a sperm, so be man who you stronger. Say the baby man survive because a man no said your masculine and a very acidic into a prostate in the function and say a release chemical be along with seminal vesicles so the chemical said the bear sperm no with me I survival until a major function.
Okay.
Yeah.
Now, any
Senior,
function there in terms of, Bearman said, sorry anymore.
oh, there be, and no, the function, a fancy, be a war, a far Bema, sorry, mostly related, say, nerves, not a free spinal cord, a Bema, to me, sorry, no, a bit pass it through prostate, no. It is but I don't just say I say the connection I say for obi prostate surgery prostatectomy now you could in prostate increase one. I was a surgeon or careful say the bear on severe nerves ni na because okatini na dia bema no ontumi sorry. But a surgeon is careful, not so year. Not a nerves in a spreader. Beman only an issue with erection.
Okay.
Yeah. And sending a air cannon say, and then the second most prostate cancer, and then the second most common cancer in the US. No, I feel beyond about 250,000 new prostate cancer cases in Kenya. And it's at 250,000, it moves by 34,000 a year. Numbers may not seem that much, but when I'm trying to compare, say, yeah, you know, Kumasi, and I say, you can Accra sports stadium. No. This is about the capacity of such stadium. Kumasi Sports Stadium, I'm saying about 40,000 capacity, it's just slightly more than 34,000. You can say, Kumasi Sports Stadium, I bomb map with a mema, where a mema cook from the account. No money, yeah. It's serious. Say, it's most men diagnosed with prostate cancer do not die from it. Say, even though 250,000 you bet the diagnosis every year, majority so any prostate cancer because for some reason the between prostate cancer no more body in the immune system na aka cancer na share so much ya dey fufuro bi na bekum mu papro na bia okowu na say bia bibi nti akoy na autopsy na fe dey ekohwe prostate no oh sa cancer kra wu but cancer na
okay.
Until risk factors any day a DNA ma obi a likely say obi ebenya prostate cancer. Number one, no, you can't say so your bema because any my idea into the mere fact say obi a bema and slide then and move. Yeah, I say 1 man in 8 or 1 in 8 men will be diagnosed with prostate cancer during his lifetime. Another risk factor, and that's idea will be bema more likely to between your prostate cancer. A new fear wedi. If you feel prove 50 years, now risk and increase. Say, almost this in fear 65 and over now. We 10 and 65 or older than 65. Mema 10. A moon 6 no. A bit not prostate cancer. But mema we are under the age of 40 years. A very rare. So who say prostate cancer will be all under the age. But who be not family history. I say yeah. Who tuntum which applies to you almost here you say Africa for and Ghana for you now. Who tuntum no. Oh high risk of between your prostate cancer. Tuntum bema. That yes, unfortunately, your prostate cancer and it appears to be more aggressive and more advanced. And most likely related to the way I you see share and pomudino. Yeah, exercise. say regular checkups, no. For yeah, and they both a man, but the man is worse. And maybe kaka family history no say a one man, she be one a womb kakra. Into you say 5 to 10% is due to family predisposition. It be one man, they say prostate cancer and cigarette nom.
Hey.
Cigarette or mo bu on ma wadane ne hwene mu chimney. Cancer now one of the worst things I would buy to your own body no. Osha Niema Bronsam a design to basically destroy the body now. One of the worst things I've been some a cigarette smoking. Any Fasobia wo nipeduan. Dear and say a say nipeduan and say no gradually. Kakran. Na a say nipeduan. Inti mo amonum cigarette no. Se mu betumi a and I say
na we swear.
We dear, we know probably, I don't mean 100% certain, but we say cigarettes and nicotine, the major thing a cause problem, no. And we is the chemical I'm saying cannabinoid, no, and only a bit different. But we dear, this is a Milukuna app, not verified, you see prostate cancer risk, but any 100% certain. Yeah.
Now can be this family history, right? Yeah, and so can say a member will be now omu free mono. Yeah, sometimes omu nim so will be right. So is there a way to be able to track back? Say, oh, my bush enemy will be in the mania here, maybe mammy no cigarette in those kind of things.
Yeah, there's a way, and unfortunately, Ghana for especially, very, very poor historians. And idea what we should be normally on control. On control. This is someone one can find out. Yeah, share some information, and it's very sad because so we share who doctor and that's only a healthcare professional can say idea back a bit more buono about good history about Ebusian. Yeah, into the Busian be one more. Not diabetes. The diabetes example. Busian be one diabetes room.
Yeah.
I was saying who free Busian, yeah, dear, coso Busian.
Right.
I quite about who I say. You better catch one answer baby questions. Only or first mobile home in town. Money home in town. In like say diabetes and a cocrambi war mission. Now one unim. Catch one catch your doctors as well. Not just one so nim said there will be sharing to also pay more attention. Yeah, and into I was say as much as possible. So we are younger, or parents. They wouldn't even war for no one parents there. Try and know what is going on in their health, because homogeneous no their war.
Yeah.
If you cause war or if I say genetic be one man, also do a high risk. Without that, very, very difficult.
Oh, good.
Yeah.
All right. So I think that answers the question of family history because we've been honestly speaking. So
yeah. You miss a question. So no, if one man say be a friend say we bush any be what is a wire, yes, I quite say you be a bisa question say a DN search no quay, a DN unya, who would say, oh, I wish you be my man and I'm papa being a cancer, who be a cancer man, no name. Also, you have to know it. Now, don't just keep it to yourself. Catch your doctor. No, because ebusian sem na enye ebusian chobo you next of kin. I say a woman, papa, unuanom, war aunties, war uncles, and the very close family unit. And no, a clue as to say, pay more attention to you, and I say, say, would you a regular person? Yeah, and another risk factor is obesity. almost Omunya prostate cancer, omudia more aggressive and more fatal. Just a kum. It become quickly cry. Or enna see a koyene a fancy surgery cry na say a yen chemo cry na was a miracle and a radiation cry on the bit mass ababium. They have an increased recurrence rate. Signs and symptoms in any DNA. AD kind no obi amfa nhye ne tirim say ubetwenya prostate cancer. And that's a blue one man prostate cancer share no ho to no nim. They may not be any symptoms at early stages. And no information will very important. Also be added to it because a bad diagnosis now a very more relevant there. Until no man until the officer will be fine, but not be because we need to be. Until a fine bench and I be officer or a fine and also see who say prostate be a BB because why a artichima one immediate. The other one say, in more advanced stages, symptoms overlap with benign prostate conditions. Obu on one need the onya prostate cancer na ekesi na symptoms no it mean other prostate conditions are back we can one sense be a prostatitis and I say benign prostatic hypertrophy. It mean BPH, it mean initia. Ebini saying trouble urinating. They can say a person prostate in a sarando drobena jones of feminine. It is a yekesia, it me compress drobeno. Now fade from blood and it mean for moon p amount Johnson out. Now I say a year papa and a bema, now I say nayasi ya because the blood and who said balloon. I have frequent Ebasana yetumi fencing sebia Johnson yekesia na say you bet me the actress say the tube catheter you bet me passing through the urethra and to the prostate but say a block na a tube need me and found the and this say you call na a basically the tube you try to crew I mean you try below a full man near the tube near the overall blood near draining.
Wow.
Because blood and say just so be boom be back it off. Now across through the urethra to kidneys. And now and also a child is when you hydronephrosis, basically it's kidneys. Yeah, it can be very serious. But send a canon and known as for prostate cancer, there be advanced stages na be bisa. But your benign conditions obi wonma enye cancer but the prostate I can see it is BPH, benign prostatic hypertrophy. No, I can see and hyperplasia. And also trouble frequent urination. Frequent urination to the explanation is a bladder no a store so on. And say your prostate here can see and say a pushy up against a bladder now. The space now bladder na eketwa. Into bladder and can hold urine can see. Into when said a Biana Johnson now more frequent. But and also some symptoms no it doesn't mean say you'll be doing so very frequent. It doesn't mean say when you have prostate cancer. They may be no.
Yeah.
It doesn't mean it can be a sign of, but it doesn't mean say it could be say diabetes in the
yeah.
It could be say a urinary tract infection being a which is usually not common in memory, but it could be say be a winya. It could be say be a BPH and and decreased force in urine stream. One man and nam se tokro no say a compressing urethra and tokro na ke 20 Johnson cry a say like the force and the decrease because tokro na shrink tokro na mana blood in the urine we can wasem say mucosa na lining urethra and baby drobena to so feminine lining no say cancer he to lining na it me bleed. It can be a sign of prostate cancer. It doesn't mean say when you have prostate cancer, yes, I need diagnosis prostate cancer, but it means say na enko check it na make sure say unya prostate cancer and I say a DNA cause wo nipa dua no blood in the semen once a prostate so me can say there's a part a drawbane and I say because I branch it on me go back to picture now for say sometimes the picture can explain it drawbane no yeah I do the
Anyway, yeah.
drawbane a branch
Yeah.
into the be one man not a semen not say a I can't say I affected this part no into the bones in that or the Johnson not semen say a woman into an also no can be a sign semen and a woman and on any idea will be this is be a urine cytology be an answer be for some reason for test you for show urine Johnson under the microscope and then I can say yeah bone pain then say aspirate on prostate no prostate cancer no ban bia or per se or spread it one of the first places to occur bone especially or spine or pelpa into any hip bones no now I say into so go on my boss na lower back pain on the hip pain upper thigh pain into ano nyina so wo feel pain pa wo dom pain inside bibia na fan show cornea check does not mean so your prostate cancer because other diseases which may manifest the same way. There will be a friend plasmacytoma, a blood cancer, but a plasma cells, type of cells be plasma cells. No, a bar it means so a boom, and I said multiple myeloma. Yeah, and then multiple myeloma and plasmacytoma, and basically the same thing. The only difference is say plasmacytoma and a one area, a more space.
Okay.
In terms of me,
Minchuan no campaign who asem about like CCRA, like lower back pain. I don't know you think you can say dull one and I say sharp pains and I say what do you think?
Most likely and most often a dull pain, but what tiny don't pain will feel pain would don't pain and cause our nerves were inside or until like there are nerve receptors or the pain inside marrow into the feel me don't pain me and yet sharp pain to say be a sciatica, a type of a pain maybe. And only a sharp pain usually nerves nerves sharp pain. But don't pain gently a dull like or feel pain be
okay.
Yeah. Unintentional weight loss. If you say they be an docno 3 balls. What bossa na fe de ugusu bought 3 balls every day be and lose weight. And then if an unintentional weight loss. And yes, I watch that plan and say me lose weight. Why can't you do exercise then there? You do normal life. No lose weight. It doesn't mean say when you have cancer, not prostate cancer, but you have to go check it out. It's normal. It could be the diabetes. Diabetes is to me also, sir. But the can say unya we are go get the checker. The hunya man the umunya hunya no check it out. Erectile dysfunction.
Okay.
The bearman to me and then they know who say can't you don't pay emuya ya ebu events so moja name grawa and fan but don't you say the bearman and they do record expansion
I think the last time you knew be home from one another say and no kind of a woman catch it sometimes a lot of diseases I won't remember hypertension diabetes who say that's when they seek help and then they treat.
So and then you know because who could take a radio commercials about 90% about erectile dysfunction because I know na member no mu here you be there don't be they don't care but I dey need to say they all can be a diabetic ne ni nyina efra
Yeah.
But when you say, I feel me be man affected the no drink, which is sad. Because some often by the time I say erectile dysfunction, now other issues be on one that was like with me catching no man pass it that. Incontinence now after you like just sort the drain and that's why you're faster. But just and also can be a sign of prostate cancer. And I say, and again, and yet just prostate cancer, infection crown will be a UTI between your symptom. But the point again, Yak Haman San say, the air kind and say, Unya beer, not doctor.
Yeah. All right, you answer over to us on acknowledge your Facebook comments about Nana Kofi good and I think it's okay range. Me made time in the course school on say on no answer no can smoking no once more. And I can see the Moses so say hi there was some in the morning. Mr. Mamon share, especially Mon share Munam for Mema on which me benefited from this. You because yeah.
A year no crab one man be brave because Obano young Bibia no academy papa.
Go check it. Yep, and no home boapa until you make sure they take care of your health. And say my doctor Konumu Soka Baba cannot over train quite fast was here can symptoms name and no signs and symptoms you hear Yarena ba as we see a swan and even class this diagnosis in the account. And Tianche home be every train one basis here.
Are you 65 years or older? Good news. Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS, IL65 to 773-420-8976. It's true. For most people, your health insurance program increases as you grow older. That's why the state of Illinois has expanded its Medicaid health insurance program to everyone 65 and older, regardless of your immigration status. Need help to apply? Contact United African Organization, UAO, WhatsApp, SMS IL65 to 773-420-8976. If you are 65 years and older, there's one thing we can all agree on. Your health and well-being is important. Whether you are a recent green card holder or retiree, asylee or without paper, you're now eligible for the Illinois Medicaid Health Insurance Program. Need help to apply? Contact United African Organization, WhatsApp, SMS IL65 to 773-420-8976. Documents needed to apply: your proof of ID, your proof of address, and your proof of income.
Miniaba eni ma medufi oyeduma odukisi anopa biara minia be sori ahoɔden mu no kwadwuma on complain da se no ba bitutu no sanso na mebra o efitani o tu engine no opagya engine de ka adwuma se de sitie da bi biara no ho dendenden mi ameyire o store no adi ni dwa meyire ensori anopa enka se na nia ha anase no ho ye ne mreda sanem papa ne mfia konkan ono so complain da se no ba bia ne ya o sori anopa na no afanse kan no okonefu me akrobeto madwuma meye me kan news na me acte na me komeba da biara no ebra me de bedam na adias nanso men sorry da krokranka se me hu ba bia me ya ne nyina gya se yo secret ahuntasem eyaduru a de boy ho ba ne nyina ni kowa mesha kurani eyaduru a onomu a ebo nipadua no ema wosi pi wosita me kanfo ama wo se wonso no nom kowa mesha ni bi na babua na aboa no abusua na yare da ho eya nunum bi na obedia danse ubenya bi ato o ba bi eton no bia na opedodo atunsu a fresh telephone number
0591 565 778 0509 876 891 and at 0547 641 310. So what per kwa mixture ato ewa America brochi memua called One African Market, Bolingbrook, Illinois 630-914-5698. Shay's African Caribbean Market, Crest Hill, Illinois 815-524-7261. Makola African Market, Chicago, Illinois 773-654-1971. Kaneshi African Market, Columbus, Ohio 732-773-4714. From Mr. Safo Adonona Freno Agenda, it was 0773-610-1112.
Kowa mesha abusia amintasem.
FDA ahwehwe edwadie nkratoyi agiatum se eye.
Yo, and say your son back and that's a set one kusuana mutin and say any doctor to bet one accommodation. And doctor to somewhere.
Yo, a for you that's mercy. It was no as a sit down in a ye screening and I see a tuition in who say obi in your prostate cancer and I say or say pay attention to it because it be or high risk with your prostate cancer. Now maybe 1 second.
Okay.
Okay. Yeah. You may hint say now a PSA is screen very sensitive no internet. Now Oceana be lead to overdiagnosis. I say there's concern about high rate of overdiagnosis, detecting disease that would never have caused symptoms or harm. High potential for serious side effects associated with treatment. Hence, routine screening for men at average risk is not recommended. Nipa bebree bɛrima biara no there's that statistics but say bɛrima wonyini ɛfa sɛ do 90s a ɔmo mɛrima wonyini do ɔmo 90s bia na tiri na heart attack anaasɛ akoma problem anaasɛ breathing difficult pneumonia bi na ebekum no yɛkɔhwɛ prostate mu at autopsy a bebree na no wɔ prostate cancer banyɛ prostate cancer no lekum wɔn nti ne kyerɛ sɛ yes, say you say be prostate cancer, but in terms of how you be managing or say careful, because I don't know who will be not saying kumwa, and that's what being say a nipa do on a mudia, and what say beer or be a bones when you be any to look at the narco table soon, because I know so on the side effects. Right. When in the idea about what ye say it first, Nanky in him, sir. But to see idea you say we have to be very careful. Say yen treating the pain the same. So in panel an average risk routine screening and recommended. Now American Cancer Society recommend they say no age 50 it used to be I think 40 years, but you see an 50 screening starting at age 50. And here, like normal risk factors, so say be a upapa prostate cancer or that's a new mobushi and you need those things. Starting at age 15 years, such as screening. Men at average risk of prostate cancer and have a life expectancy of at least 10 years should have a conversation with their health care provider about the benefits and limitations of PSA testing and make an informed decision about whether to be tested based on their personal values and preferences. 18, so will be your average age. Not say be no average risk factors. Not say it be the life expectancy, which you say at least 10 years. Talk to your doctor because and yet just one that's a factor penny issue. Multiple things. You should have a conversation with Dr. Nobody say, once starting your PSA now, men at high risk and high risk in the black men. Into Ghana for 18 no. They're kind of first and average risk, high risk. And men at high risk, black men, and those with a close relative diagnosed before age 65. Until we tuntuni bema. Nase a specialist obusuani bi enya prostate cancer before so be 65. Also, you should have this discussion beginning at age 45. To one man 50 years. These are common in term. Those with an even higher risk, several close relatives diagnosed at an early stage should have this discussion beginning at age 40. In Jamaica say multiple things now, doctor no. Only this so. And it is a question back to question I will be say about family history no.
Yeah.
Was say what is we any being a cancer. Yeah. He said cancer bang na even crying so or catch or say ebia my wo dear like first of your bows my wo dear in the minya bisan say wa wo dear he ni din bisan cancer bia wo din so
Right.
bi cancer bia di as much information a ubenya bia nje na no doctor eni nkomo because some information are dey man no
Yeah.
and ebe amana stratify we say wo a higher risk and I say we average risk and that's how we are saying no I was see di example no but yenina Ghanaian society are very difficult to get those information and
Oh yeah. Yeah.
Parents they don't want to tell
I'm
you.
on cancer. Problem no.
PSA, prostate specific antigen, and only a test now you can say you screen, you know. Another way is to a digital rectal exam. Just fancy name for say, yeah, my bear man that or Dr. Nash glove or the be a lubricant a crabby afan in a sound. No, the afa or a anus through anus, it may be feeling prostate, you know. Here's a more picture. Other honoma or share glove now the prostate into no the feely prostate because a lot of prostate cancers and started the chihade no or into no ophelia normal prostate no ophelia I was say no son if you say on be smooth so like a dasso a smooth surface is smooth but say ophelia bumps which is no normal.
Problem of
Really not. And I can't digital rectal exams. We used to just a first a card that summarize it at the first yakanina. I mean, yakan say at age 14, just talk to your physician about testing in your personal risk into family history. So, or doctor, no. Say you only the share obusua nyina na ohun de ekoso obusua mu nti yen so as patients no and as individual you are studie say you informed about your family history. Age 45 to 49 also have a baseline PSA and digital rectal exam. If PSA and basically no di 40 we between 45 to 49 I was say doctor no doctor di nkomo na oche oyetwe umoja ko test for PSA ni bi ni ehu baseline ehu say okay wo normally no yes when your prostate cancer but you an idea say okay normally nipa no prostate na the level say ni PSA no the level say na wo or see if PSA is above 1 nanograms per ml repeat at 1 to 2 year intervals until age 50. If PSA is below 1 nanogram per ml, repeat PSA at age 15. When there are guidelines for doctors to know the next steps. What in fear 50 to 70 years are? If you better check your PSA below 3 nanogram per ml, there will see a repeated testing at 1 to 2 year intervals. If you bro 70 years, or say a no doctor and first enkasa. No share with wapomudien generally ehun first no m1 na mumienu no montas decide say ehun yakra say obey koso first PSA testing. One thing about prostate cancer they say a slow growing cancer or just be everyone will be na say 80 years na fini diagnosis prostate cancer na on said that yes symptomatic most why hanya na hwe you look at say yeah, until we are about digital rectal exams. Another thing is so digital rectal exams or the inside far anus through the rectum feel prostate. No, that's a officer bombs or honma. It may a ultrasound transrectal, probe near the far rectum near the a fancy nodule chrono feel I say. Who you say a biopsy, and an MRI. So a fancy you say MRI machine, you know, the nipa no that's so near the narco shame na a child photo any tissues now.
Okay.
And I also say and but the key pan a biopsy. Biopsy in the bed say a cancer and a cancer. So you're sure and I say you're suspicious and they by cancer by a year. If you plan no. Oh, yeah, sure, crab by exams. you need tissue diagnosis for like insurance fund to approve treatment because as I say, what the word in cancer be a cancer. Biopsy is very, very important. In terms of biopsy, their brain first pathologist, no what share. I can say, okay, cancer and cancer.
Okay. And a bit me show stage now.
Yes.
Okay.
Your biopsy now, a biopsy, no, say you grade, no. Cancer, no, it should be a one man or more aggressive. It's different Gleason scoring. Or Gleason score. Na stage the fencing this be a full body scan na and a born like clinical staging but say be omo fi say be wo bone na bone easy say be biopsy so be biopsy na say pathologic staging it's in the bone scan so one thing and no so you chat or don't penny na I can say prostate cancer or predilection say or spread or bones and another the spine hip bones, thigh bones, those bones. Until a full body bone scan. Now you who say be a baby light up na. Another scan, so PET scan. On PET scan and then a check for metabolic activity because cancer a grow cancer be as a grow more than a normal. As a baby as so grow to say be exercise. Oh, exercise our body in air warm. Yes, activities no high. It PET scan and it checks for metabolic activity. Now, air high no not air bright imaging so.
Okay.
Into the picture where obi a fence obi bones scan. Into which would back where a fence bladder and a show black, but share na bacteria which are high black. Ocean ribs na black dots ni na cancer one ribs ni na betino. Ocean papa we on picture the cancer na didn't ni peduane na the hip bones no way first hip bones and I black dots be pre. Ocean the thigh bones na first be wa ha. Ocean the ribs na wombs and the spine dey I am a kwa fence in the skull no. Into where first a bone scan PET scan na me say no na share metabolic activity no say na say baby metabolically active as a enema ejuma ekoso kese no say na cancer o they are very active it na say no na we are na a glow
right
very bright there's a PET avid no a biopsy ni say hu bibi say bia o feely no ye digital records and say not you be wa bomb be wa or say me enquire biopsy into no the biopsy gun no probe one ultrasound probes so one or the channel computer screen so no who say in a panel so one probe probe and a panel it was the probe no share say bia panel e wura be say wura tissue ni bi then that come pathologist no wahwe ya the crow wom say na eno no ye first biopsy no na normal prostate say any biopsy na ye kala you see ye staining say na look like eno no we no orderly we dey she cancer DNA she say na we city glands no I mean go back. Where prostate glands no. Sure, there were lots of I can say apical mucin. Bebre be kama. But in a normal any packed, any jam packed with glands. But also cancer there. Say glands when you know glands you now pack it in a small area bebre in a say a secretion with you can say crystalline secretions will prostate cancer biopsy now and that's how I diagnose prostate cancer in the PSA nebua digital rectal exams are nebua history now offense what about doctor very important Now say based on digital rectal exams, be an ultrasound or biopsy, PET scan, the account. In Sana, you did screening,
Okay.
you did diagnosing.
Yeah. I think say sometimes education should be more. Omo said you can say oh be a bit me check you more I think say it goes a long way. Because you don't go be high. Say omo to say omo BBC I say death sentence. But I don't from the way I would teach him not to say and this correct me if I'm wrong but yeah.
Oh, you're correct, pa.
Yeah.
And yet death sentence. Your certain cancers be on my predicting the prognosis is very difficult. Prostate is one of those things. Obi bet many prostate cancer and then very aggressive, not taking like in a short but most people in your prostate and take you more. There's a type of cancer be a neuroendocrine tumor. And it may yet different organs, or pancreas, or lungs. And it's saying one type of cancer, the behavior very hard to predict. Obi one ma obetmenya bi u test ya nneema show say nke aggressive behavior ni na in show but they be background.
Yeah.
A prostate na that type of cancer now it's very hard to predict any behavior no. But say Gleason scoring, we say a time na make a diagnosis now ka say a staging, we be say about staging. Gleason scoring and me my who and I just say this cancer we or no they very aggressive.
Okay.
And they say not approach so a bit aggressive.
Okay.
Yeah. But in general, so being a prostate cancer and yet death sentence, and then there also be addition teams and yet death sentence.
Kwame sure be a question. You will say does enlarged prostate mean prostate cancer?
There be. I'm saying I say and never be a few things to me my prostate enlarge. But could to me offense inflammation and say infection, prostatitis. No offense between my prostate enlarge. But no prostate enlarge na rectal exam or then inside or the fili prostate to push it down you be in pain. The infection you be in pain. And depending on how bad infection is here, or fili crana a prostate in a femu, a BB adding but say a inflammation of filia was like boggy kakra. Like in hard ways. It is said they be out there a group a bottle to a binado and say and that's a like depending on pressure we use
Okay.
I know it mean a clue say way infection. Another thing that mean prostate enlarging you can want them say a BPH or benign prostatic hypertrophy, mean kind of hyperplasia. And no say no it mean and no crown very common BPH and cancer.
Yeah.
A bit mama severe symptoms like going to mean on solving those things, no. And now between a bladder infection, no, but any cancer, I be spread the baby a bikunipa. Yeah. Into the sebet treatment in the soil.
Oh yeah, sure.
Treatment, say a active surveillance to monitor disease progression is appropriate for many with early stage diagnosis, have less aggressive tumors, and are older. Into the buonuma, you're diagnosed with prostate cancer, but they say, okay, what do no. Yeah, maltreatment be based on a certain reasons, no. But you best surveil. I say, you can say the camera too, so. Making sure say prostate cancer and any case because you can say any prostate cancer be an also treaty. Active surveillance is very important. Now you share disease progression. I say it's appropriate for many with early stage diagnosis. One manner just after start kitty on the body.
Right.
And my cancer prostate cancer is a slow growing a cancer. Compared to other cancers like colon cancer, Ujana or Bukunsis here. And I don't know, I say a best severely. Now, I say I share a negligence score now. I say, okay, the behavior and it will be a bit less aggressive or internal. And I say, I share a nipper when you papa yi wonam ho di say 90 years wakoye akoma akoma yade yaye ne surgery sa ke say basically wonam ho ne nuro na keep no alive enya fe na how to a big treatment mu na no be put amena wound yeah until enye ni nyina na was say surgery na say treaty na edu so say okay dipa show say the cancer na prostate cancer na aggressive it is either prostate no you find radical prostatectomy and na me can the side effect back say surgeon no if I say onye very meticulous which means to channel nerves na pass it through prostate ni mu na bia no bako na afi de why surgeon ni na ne be man na I can say into me enyina to say the first 90 but a chrome animal dear I can say for the most part no mama start technique no for that almost year crampo na effect keke you almost because some the robotic
okay
man no said medical kind no manko university of Ghana we secondary school na me ba han
yeah
you know manko me medical school or Ghana but my take pain say the way I call be more African man as I said nipa si wu o table so no I like no enye ni hu doctors na no say say gland be prostate na gland be moja wum pa highly until no also to control bleeding no until one control bleeding and nipa be bleed ya na say to say thyroid say those things a small organ glands there but and I'm say gland until also very careful but the hand on the one master na a surgery na make us more year crana keke no robotic no yen en sakra no or the robot na the control radiation therapy obi on my who prostate cancer na say okay ono ne dia no yen surgery but first radioactive beams on your plastic cancer cells no na kum cancer cells no basically you fry or move with a radioactive beams into no your offense anti external beam radiation your one ebi I say brachytherapy excuse me brachytherapy no say you can say radioactive chemicals mean you go can say or to channel or my yen getting to say a moon drains into what they do they say prostate baby a cancer and one not it said they offer a moon grains a small grains of rice and we share a person cancer tumor and I'm say material radioactive energy instead of over time not fry
now and interesting so another cells no right it's a bit normal cells no so
a bit normal cells no intina a friend say a radiation oncologist no obehwe how much radioactive energy see nti say kese even say a tumor no na kese obehwe say see a bit cover that area no but the best price about it say ain't go too much normal prostate ablative therapy ni say basically no ekwan ya be wipe ablation like me can say layman can say zapo first tumor no cryotherapy e do cryotherapy ni na be bia na mo ye na one or two large centers be on man no mo ye say they will try to freeze the tumor no cryo means freezing they freeze the tumor no it's a cells and a high intensity focus ultrasound therapy. And no ultrasound way, you say ultrasound, you say sound waves on. But sound waves, you know, increase the energy and the beams and the frequency now. After they generate heat. Yeah, Dr.Baidoo, the way science explain. Yeah, a bit generate heat. It's not basically a tumor cells. Another way near hormone therapy. Or another day, if I say you a drug to stop testosterone production because testosterone in prostate cancer in the airways.
Right.
In your if I say medications to block testosterone. Your first one is to stop production. So yeah, testosterone. Body near testosterone. Looks or stop say body near testosterone. The second you say a drug testosterone and yeah, no. About blocking from working into two different things. And ochiectomy ni say and no basically no you will be the show more aba say a show abano and the produce testosterone in so ko yi abana essentially
Yes, so.
yes yeah
Okay.
First and your common sir.
Yeah.
Chemotherapy is also a one way and no basically special a chemical via and the mawa. But chemotherapy is systemic the mawa and yet and the whole body never call.
Yeah.
And you know, if I say obinya by cancer, and say man chemo, I was saying because and yet cancer and yet targeted.
Yeah.
Systemic
Which makes sense. Yeah.
And immunotherapy no more be targeted. Immunotherapy ni say it's a siano no nimdiana doso intino bim cancer personal medicine.
Yeah.
Say ubi konya prostate cancer na say any type of cancer bia na bisa pathology say cancer we no ubetma che in the super kakra a one ho. Pathology say more studies or cancer no know say cancer we no or what this
Characteristics.
ligand a common one a PDL1 so PDL1 a ligand is okay and you will draw for PDL1 a drama no na I block PDL1 and that's or this EGFR say lung cancer besides EGFR never be it me test and then friend immunotherapy no.
Right.
Survival and you can't say baby say vast majority 90% are diagnosed at local or regional stage. Into never be now more prostate cancer diagnosing in term into local and just spread there and as I spread it to like just a close to baby a certain into regional stage and have a 5-year relative survival approaching 100%.
Oh, nice.
It is a in term in 5 years time, you know, say first nipa 100 in a omuna and you at local and regional stage. Over the next 5 years, we say nipa 100 in that's what you say. 5-year survival rate for disease diagnosed at a distant stage is 31%. It is a thing you can kind of way nipa 100 omuna a first a year huno and tempty who not going to boom, not called different a tissue. Open in the next 5 years, as I depend on who have a two if I say a musa 31 is that
right.
Yeah, a move nipa 100 no over a mu 31 at Tiasi.
Got it.
10
years survival.
Yeah, 10-year survival rate for all stages combined is 98%. And they were the entire winning I skew near some majority in like seen early 90%. Into 10% you late no. It is all for an average or a bear man look like say 98% in 10 years no mean at a 98 100 98 but the point is say so try now what the no and I say you be trying none the and you could say a spread here distant stage and no the survivor and look from significantly. Okay, we no fancy him say you can show a picture we, but specifically for prostate, say a though estimated deaths male prostate, or say 10%. Enebewu. Even though like Lipa 191,930 was estimated to be diagnosed in 2020. No, it won't get a 10% a 90% a fancy in right away. I think
Right.
yeah, it's a good news and at the same time bad news. You don't want to have cancer.
Yeah.
Now, preventative measures being with my preventive measures, saying DGE. It all comes back to the only one anything else you show Unipeduani.
Right.
Which Unipeduan say 24 karat gold, Ubenya 24 karat results. So, which Unipeduan say garbage, Ubenya garbage. Pathologist for your 10 year can say garbage in, garbage out. What the garbage manner, garbage results.
Right.
Your body designing. Ocean year, or best who ye. Did ye? A cat did ye, and yes, if phone a bank a cotogenis animal, there be. And no crown and yet that healthy. You can't say the fruit, the nuts, the vegetables. The original diet and Yakupon designing the bony pan of the man and a chassis and a chassis and na yenam. Into designing a pediano or designing for fruit, nuts, vegetables, grains, and haba and any original Diania and Yakupon designing. Would it be a it doesn't mean say be but and said a fancy a healthy for the pediano.
Right.
The more I will try so we stay to the original diet, the more healthier life in the bay. Exercise. And also like I said, the first and say any human and what say DG in the way exercise. We get like be active.
Right.
Now we couch potato. Now the other now what that pizza. Now see TV ufleke also watch maintain a healthy weight. We exercise, we should do any DMO automatically in weight in so by respond.
Right.
And I can say omunya prostate cancer, almost you obese almost son. Cancer and behavior and more aggressive. And even crying surgery, a radiation therapy in the crana. A cyber care, it has a higher chance a cyber baby. Routine medical checkup, very, very critical.
Yeah.
Obu man now or can't Ghana for union or come with price or medium become doctor and they say
I think that I go for take pride in that. So
exactly. It's a force, a source of pride. Say and a fancy the mere fact say who names a BB course or Nipeduan chess BB course or Nipeduan. Yeah. Because the course internal and any nana exhibited science and symptoms. And with prostate cancer, and can say many a times, and show BB as not BB air course, never break course of Nipeduan. Internet doctor, a Hanamana.
Yo, so where there. It has to be brave. I could see the mocha was where you. Oh, that's good. That's good. That's a bit brave. And say, watch your training, be brave. I think some of your crown. I won't say. I mean, unya really be an interest. That's the end of it. Basically, no bet me. After quite so bit me as no radiation or now to prevent things is what we born in maybe so some cigarette no the DME and county. You better was be take you baby and I think it's a why I did one may and baby you better share ama omo can two buck crown percent carbon a tougher there 1 minute to be na you wrap up the show.
You cheer for any ahwefo nyina ye damasi DrEOfori so nyame sure wo say a program I organize the bre Ghana for akwantum ne fie nyina ye obia na wo sa ahofama no ne kwame say ombe organize the program bi say the kan nyina say for kokoram no mema ya de but ehu say oba bia so hu hia because anya bia ne bia no wo kunu na wo ba be ma wo nua be ma bi so also ye informed that also to me educate you nua no ema na wo kunu no ema ne ya aware na ye mema no ye wa ye bebre ba ko ne say ye pay attention to your health ye ignore nema ntina ena se mo ma no munim about prostate so ebo no mo the pressure esi pense mukunu no munua no mema no so na say omo mape omo hwe mo so yi obinya prostate cancer na eno nye death sentence but the key is say you be in term then spread say the can survival and say over nipa 100 na say 100 no if I say two groups of people people only 100 each group be a nipa 100 na wom na first 100 no you prostate cancer na entema in the next 5 years no nko no na emu 100% omu nyina da so tia say you in term nti ya hu bi your second group no see hu in term na say by the time you spread different parts of the body in the next 5 years no nko no na emu 31% in a tia say nti na say dodo na ewu nti the earlier you be hu no the better enu nti na hu hia say ube take wumpom din ube ni ube make appointment routine exams with your doctor no Dr.Baidoo ehun komo ube hu family history no aka say bia o yade we me papa nya bi me say nya bi na doctor na keep an eye on it. Our health is in our own hands and your doctor na nsem na wo nti no so we are active in taking care of your body no na yes as so nyame be sure na nkwa na ohema no what we din asase so na be sin that
yo Dr. to you that's bebre and that Facebook form join you na echa you that's say what share nyina ma share my nti ha na mrebe bo ebe makwan ama edi enedumadi no asi next week no nsi nyamboa na yesaba baka yebesa to us with other cancers no a home discussion nti yedase bebre bio kwame yedase so tie na hwe so next week the kwame rabbit so yeah wetin na bio ni mama nti Dr. to haya ni besi nti yedase bebre ne o time yo tifo nti ebe free dwumadi no so kra no I think say them kind no better obibia na Mr. Facebook any YouTube all the social media platforms maybe share in feed no ho nti Mr. wa mun koso na mun share my na west na any doctor to esisi ho no ebe ko actually nti me da se bebre next week no ebe san share